Who else do we have? You're the only one that came. Where's Trumbull? Where's Senator Gaynor? Well, good afternoon. It's always great to be in Panama City with my Congressman, Neil Dunn. And I also want to thank some folks we have. We have Nick Hall, who's a lieutenant with the Bay County Sheriff's Office. He's going to be talking. Amanda Watson, also the director for assisted living facility. She's going to say some stuff. I want to thank Sandon Speeding, the health officer here at Bay County. And I also want to thank everyone for coming. We've now done, in the state of Florida, since we set up our monoclonal antibody sites, we've done over 30,000 treatments for Floridians throughout the state of Florida. So we have 21 sites, including one here in Bay County. We've done close to 1,000 treatments here in Bay County since we established that site. And so we've been able to do it with 21 sites. We're doing probably about 4,000 treatments a day statewide. We're certainly happy with the results that we've seen. I think a lot of the folks, and you'll hear from some folks who have had the treatment, people say very highly about it. We were in Jacksonville earlier today. We had a woman who was really, really sick with COVID. Her mom saw one of my press conferences and said, you should go to this site in Jacksonville and get this treatment. And so she went, and she almost passed out on the floor. She was so sick. So someone took a picture and put it on. You shouldn't have probably taken that picture, but they did. It went viral. And people are like, oh, my gosh. So she did. She got the treatment. And then like 48 hours later, she was doing well. And she credits that with keeping her out of the ICU and saving her life. We also saw some folks we were in Tampa. There's a family in Sarasota, a father and grandfather. Yeah, we had the granddaughter and the daughter. He's fully vaccinated, World War II veteran, was in a facility because he had some other problems, and there was an outbreak, and he got COVID. And as a vaccinated person, started developing symptoms, and they were trying to figure out what could they do to treat him. And so they were working with the facility, and basically giving him the runaround. And so finally, they called our office, and we put him in contact with our Division of Emergency Management, Chief Medical Officer, and we set a strike team in there to help him and anyone else who wanted it. And so now he's doing much better, and they credit this for that. So what we've seen statewide, fortunately, we're seeing hospital admissions decline for COVID. We're seeing the COVID census statewide for patients who are COVID positive trend downward, which is great. And we're also seeing declining visits to the emergency room for COVID-like illness. And so at the end of the day, keeping people out of the hospital, if you don't ever go to the hospital, you're obviously going to recover, and definitely saving lives with this treatment. We've been able to, in Florida, we have nearly 13 million Floridians that have been vaccinated. And if you look at the data that we've seen throughout Florida, particularly this summer, the people that get admitted to the hospital tend to be people that were not previously vaccinated. It's probably about 80% on average. Some it's even higher of the percentage of patients who are not vaccinated. And I would say of the people that are being admitted regardless of vaccination status, it's like over 90% that didn't get the monoclonal antibody treatment. And so we saw over the summer that this was something, as you started to see more people go in the hospital, a lot of people weren't doing this. They didn't know about it. And really at that time, you needed a physician to refer you to one of these infusion centers. And so we looked at that, we said, okay, we got to let people know this is an option, because what we were seeing is it wasn't just unvaccinated people that were testing positive. People who were vaccinated were testing positive. And if you have vaccinated most of the high-risk people, and those high-risk people test positive, even if the vaccine's very effective, you're going to have some people, immune compromised, other conditions, that may want to get some treatment. And so we viewed this as something that was simply being underutilized. So we started talking more about it. People were really interested about getting more information. And so he said, you know what, we need to help the effort, because these hospitals have so much that they have to juggle, and it's not always available in our healthcare system. So we set up these sites, now 21. So this has been a very quick effort. It's already having a positive impact, and we want to keep it going. But I think what we're seeing with the data is pretty clear. I mean, you know, if you're vaccinated, you're much less likely to be hospitalized for COVID. And then if you get infected with COVID, you're much less likely to be hospitalized if you do one of these Regeneron treatments. And so we know what the tools are, and we want people to be able to have, and again, this treatment, it's your choice. We're not, no one's going to be forced to take any type of monoclonal antibodies. But we have a track record with it, and it's something that has really made a difference in people. And I think, had this been something that had been more, I guess, on the front burner in terms of some of the public discussion since the EUA for this came out in December, I think we could have avoided a lot of hospitalizations. I think we could have saved, nationally, could have saved a lot more lives, because I think a lot of people that were ending up being hospitalized didn't know about this, particularly in the early part of the year when the vaccines were in short supply. We're focusing on elderly people. In Florida we were, but even when you get vaccinated, it takes 6 weeks for that to really kick in and give you the protection. So we weren't even in a situation probably until like April where that was really fully kicking in, and that's true nationwide. And so I just think that we want to make sure all the tools are available. So we have that. We're excited about it. We have one here at the Bay County Fairgrounds. As I said, we're close to 1,000 people have received treatments at this site, which is very good. We're also happy. Look, we're seeing the hospital census in Bay County decline, the emergency visits decline. That's a good trend. These treatments can help keep us going in that direction. If you are interested in finding any treatment site, any of these sites we've set up in the state, go to FloridaHealthCovid19.gov. That will have a list of all the sites. And if you want to make an appointment, you can do patientportalfl.com. It had been that you needed a referral from a physician to be able to go to one of the infusion centers that, let's say, the hospitals were running. What we've done in Florida to make it easier for people is do a standing order from the Surgeon General of Florida. So if you're somebody that is COVID positive and you fit the basic criteria, which are pretty broad, you can come directly here with an appointment. You don't necessarily have to be referred from a physician. We're not saying don't talk to your physician. You do what you got to do. But you're not going to need a sheet of paper. You're not going to necessarily need a referral. So we want to make it easier for folks to be able to benefit from this. There's also what the 21 sites the state's done is part of the availability, but they are being offered with different healthcare systems and hospitals and even some physicians. So if none of these sites are convenient for you, check to see what you have in some of the other parts of your community, because this is not the only game in town. We're really supplementing efforts that were already going on. And so who are the folks that are most likely to benefit from this? It's really the people that are at the highest risk from being seriously ill because of COVID. So obviously elderly people, people that are immune compromised, people that are overweight. That's a really big one in terms of the folks that end up hospitalized, people that have diabetes, people that have kidney problems, people that have heart problems or lung conditions. So if you're in that group and you're COVID positive, this is something that really can make a difference. And I'd say that's true for people regardless of vaccination status. If you look, the National Institute of Health, they even say that they do not, that if you are, regardless of your vaccination status, the treatment protocols are the same. So if you can benefit from monoclonal antibodies, you should do it regardless of that status. And we believe early is the better. What happens with this is that if you do it early, that antibody cocktail gets in, it starts really fighting back, your body fighting back against the virus. If this virus takes hold too much, you end up in the ICU. By the time you would do this, it's likely progressed too far where this is going to have a really great impact. So early is really key. And we've had people, the lady this morning who was in really bad shape, I mean, she got it on, I think, day 9 of her infection, which is later than you'd like. You'd really want to get it, probably around day 5 or 6, ideally, or whenever you start to be symptomatic. So, but it worked for her. Now, there's other people that end up really, really sick, ICU, even mechanical ventilation. At that point, this just is probably not going to be able to do it. So I'm going to have a couple of these folks come up, talk about the impact that this had on him, or on them. So we have Nick Hall, who's a lieutenant with the Bay County Sheriff's Office. So he's going to come up here and talk about what he's done, and then we'll hear from Amanda Watson. So Nick, you want to come up?
Thanks, sir. Yep. My name is Lieutenant Nicholas Hall. I work for the Bay County Sheriff's Office, and I tested positive for COVID on a Monday, after one of my colleagues and friends had been out with COVID and got very sick. Still was struggling with it for going on a week at that time. I went and got tested, was positive, sent out of work, quarantined to my house, staying away from my family and my loved ones. A friend of mine reached out to me to check, say how I was doing. He was aware of the Regeneron treatment that I had never heard of. Told me, look, as soon as you start feeling bad, because at that time I felt okay, call me, because you need to get this and get it quick. Come Wednesday, I started feeling a little worse. On Thursday, I started doing my first little bit of physical activity and realized how bad I was by how tired I got just hanging a TV. I felt like I ran a 5K. It was terrible. Friday morning, I woke up and was just body aches, felt just completely like I was run down. My wife urged me to make the phone call, so I did. Referred me to a doctor up at the hospital in Bonifay. Spoke with him, got me in. I got the treatment that evening at 6:30. Saturday, I already felt better. Sunday, felt like nothing was going on. Monday, made a phone call to work. Hey, can I come back to work? When you work again? Wednesday. Sure. Back to work on Wednesday. Like nothing had happened. No lasting things for me. I truly believe that my condition would have worsened if I had not got it. I was grateful that I had some friends who were aware of it that turned me on to it. And since then, it's now really out there and everybody's aware. And I thank the governor for it. To let everybody know that it's available for you. So for me, truly believe it kept me from getting worse, definitely helped me out, and I'm grateful for it. So thank you.
Great. Amanda?
So I'm Amanda Watson. I am the Director of Operations for Veritas Care and oversee 5 Florida communities that are assisted livings. So as the positivity rate in the counties are at a 10% increase, then we have to all be tested. So that's why I was tested on a Tuesday. Thursday morning, I felt a little odd. Sure enough, Thursday night, my results were positive. By day 4, I felt like I was knocking on death's door. I knew I had to stay active and stay busy to try to push through it. I went out to the mailbox, couldn't hardly make it back. I knew then, okay, this is serious. So the next day, contacted my primary on day 7, was given the monoclonal infusion, and by Saturday, that was on Thursday, on Saturday, I felt 100% better. I could go out to the mailbox, even took the kids and did their school shopping Saturday. So it was definitely a game changer. Since then, I've had several people reach out to me, hey, what did you do? What did you do? Recommended it. Dave had it and have had great results as well. There is no doubt that if I would not have had that infusion whenever I did, that I was headed right on into the hospital with pneumonia. The shortness of breath was real. So it was definitely a game changer.
Great. Thank you.
Thank you.
Neil?
I want to thank Governor DeSantis once again for aggressively deploying this therapy in Florida ahead of everybody else. This sign says it all. Early treatment. If you have any symptoms, this is me being doctor, not congressman, any symptoms and you test positive, go get the monoclonal antibody treatment. It's just that simple. Earlier is much, much better. And the reason we have it so available in the state of Florida is standing right over here. Thank you very much, Governor DeSantis.
Thank you. Appreciate it. And so it's important that this become part of just how people respond when you have COVID infections. I mean, I think that when we had the big vaccine drive, I think everybody hoped that anyone who was vaccinated, you would not be able to get COVID at all, and it would create a big shield of immunity. And, you'd still have it in the background, but you wouldn't have a wave of infections. But I think we're seeing that, the vaccine's true value is in reducing severity of illness, protecting against death and serious illness and hospitalization, which honestly is the most important thing. But we are seeing that it's not necessarily preventing spread. You're seeing these waves, and not just in Florida. I mean, obviously the South, throughout the whole South, we've had a wave this summer. But you look at Israel, one of the most vaccinated places. Hawaii is having a big wave. So this is just something that we're going to have to deal with. So the question is okay, COVID's going to be with us. You have tools to be able to best protect yourself, obviously from a prevention perspective, the vaccination. But then if you are infected, particularly if you're high risk, then what do you do? And this has just got to be something that everyone knows about. I mean, 100% of the people know that there are vaccines available. I bet you less than 25% of the people in Florida a month ago knew about monoclonal antibodies, and maybe even less than that. Now we're starting to really get more people to understand that this is a possibility for them. And again, it's available, no mandate or anything to do it. If it's right for you, do it. But we really think the results have been good. So we just are glad that we've been able to bring it to Bay County. We're glad the results have been good here, and we want to keep going. But as we go forward, and as we get in the next weeks and months, and there'll probably be a wave in the winter, this has just got to be something. And we really do, because we know that this is something that's not going away, treatment does need to be talked about more. And I kind of feel like this is something that people just didn't want to talk about for whatever reason. And I think some of it was people thought that if there was a treatment that people then would say, well, I don't need to get vaccinated. That's not the message at all. This is in addition to that, but you got to tell people what their options are. And if you have something like the monoclonal, this Regeneron, that's very good. We also have one by GlaxoSmithKline that's come out more recently that is also super effective. Now, that is not what we're using because we're taking this from the federal government. Federal government's already paid for this. This does not cost a patient any money, what we're doing in our clinics. And so don't let anyone tell you you're going to have to pay $2,000. That's just totally false. The GlaxoSmithKline one is very effective against the Delta variant as well. That's a traditional infusion. I don't think that's been approved for shots yet. The shots are easier to administer because the infusion, you got to be in the chair for a while. So we like to have the ability to do it subcutaneously. Nevertheless, that I think is going to start to be used more and more. It's not used that much that we can tell throughout Florida yet, but I think it will be. And I think the way it is, that is a little bit more quote expensive, but I think between some of the federal rebates, some of these other things, most of the patients can get it, without very much damage, which is good. So we're looking at that, and obviously we will let people know if that is something is a viable option. Maybe not on our sites, but with our private health system. So. Thanks for everyone's hard work here. We're glad things, are starting to move in the right direction, and we're going to keep doing this to keep more and more people out of the hospital. All right, I can take a question or two before I leave. You guys got anything?
Yeah, I got something. So unfortunately this summer our state did see some unsettling numbers in regards to daily number of cases and records. Moving forward, what are you going to do to help combat that and make sure we never hit that peak again?
So it's a good question. So if you look this summer, every single state had higher cases than they did last year at the same time. And you think about, okay, we have all these people that have natural immunity through infection, which is real, and which people do need to acknowledge. And then you've had huge, we have 13 million just in Florida. Nationwide, there's probably, 150, 200 million people have been vaccinated. You would think that, okay, if you're going to have a wave, it's going to be less than what you've had in the past. And so I think we just have to understand this Delta is very, very contagious. It's much more contagious than what we dealt with last summer. It's airborne, whereas when COVID first came, we were really concerned, or we thought, about respiratory droplets. That's why they would say 6 foot of social distance, because the idea was, if you're more than 6 feet away from me and I sneeze or cough, that's not going to reach you, and so you're not going to get infected. And maybe that was true at the time. Now, though, it's pretty clear that what's happening, these are aerosols that are in the air, and so particularly if you're in indoor environments, that's just something that you're going to have to contend with. And as long as people have to breathe to live, there is going to be there's going to be an issue with it. And so I just think we just need to understand that and prepare ourselves as best we can. The vaccines don't stop cases, unfortunately, but they will keep you out of the hospital most likely. And if you look at the mortality for people that have been vaccinated this summer, we have had some, but it's very low, and particularly when you consider the people most at risk of mortality from COVID, 50 and above, we have like almost 85% of them are vaccinated. And so really it's that 15% over 50 who aren't vaccinated that are accounting for a disproportionate amount of the mortality. And so that's just something that's just what the facts are. So we know what the tools are. And I think the fact, you never want to go through this, obviously, but I think the fact that people, I think now understand, I think there was a belief, I never said this, but I think there was a hope from some people that because we had the vaccines that this would kind of peter out once everybody or a lot of people got vaccinated. In fact, there were some in D.C. that said if you just had 50% vaccination, you wouldn't see any more waves. Well, that obviously isn't true because we're seeing that in different places. So that's just what we're dealing with, but I think use the tools that we have. And I really believe had this early treatment been something that was much more prevalent in kind of people's consciousness over the last 6 months, I think a lot of the people that were hospitalized may have been able to not be hospitalized. Yes, ma'am.
I have a question. So this treatment is supposed to significantly alleviate symptoms quickly. Can you kind of describe in just the simplest way possible how exactly it works?
So it's basically, it's an antibody cocktail. So most people who get COVID, particularly the Delta variant, they handle it fine. You know, maybe you'll have a fever or whatever, but it'd be equivalent to a cold or a flu for the majority of people. Obviously, young people, people who don't have any health problems. And that's because, you know, their body's creating antibodies when they get infected, and the antibodies fight back against the virus and basically keep it in check. Well, there's other people, particularly the older you get, particularly if you have health problems, particularly for people that are overweight, diabetes, the like, that if you get infected, your body may not be producing the antibodies that it needs to produce to really hold it off. And so if you're not doing that, the virus takes hold more and more, and then it gets to a point where it's really dominating you. You end up in the hospital, in the ICU. And so what this is doing is what your body's not doing naturally, it's basically substituting with these antibodies to fight back against it. You know, there's some patients that have taken this that are well known, where I've spoken to the physicians about it, and they said, you know, patient X was not producing any antibodies before they did the Regeneron or before they did the Eli Lilly was used early on. Delta hasn't been as effective about it. So that's really what it is. It's arming your body to be able to fight back against the virus with these antibodies. And that's why when people say, oh man, I felt like I was on death's doorstep on Friday, got it on Friday night, and then by Sunday, I felt my symptoms resolve. That's because you weren't producing the antibodies necessary to really fight it back. Now this comes in and it's really doing work for you. So that's just the nature of what it is. And it's people sometimes have questions about, hey, you know, what is this? Is it safe? Is this because it is an emergency use? But the concept of monoclonal antibodies is not new. This has been done for decades for different things. This is obviously geared towards COVID-19. This Regeneron is one. It's not the only one, as I mentioned, with the Glaxo, and then the Lilly, which isn't being used anymore because of Delta. But so this is not something that is like totally new, because some people look, you know, the Pfizer and the Moderna are mRNA vaccines, and that's a relatively new technology. So sometimes people have questions about it. This monoclonal is not really new technology. I mean, this is something that's been tried, and it's delivered in different contexts, and it is delivering here in this case as well. So, if the message is, you know, if you find yourself infected with COVID, particularly if you're in a high-risk group, this treatment is something that can really help you. So we'd encourage you to look closely at it, and we're happy that we're able to provide some assistance for people to be able to get it. All right, everybody, thanks a lot. Great to see you.
Doctor, to see you.